Hello and welcome back to another video with the Practice Nurse Mentor. I'm Alicia. Always good to see you again. So in this video, I thought that we would go through about Medicare item numbers. This might be a bit more skewed towards nurses new to working in general practice and trying to become familiar with the large amount of information that is going to be poured into your brain. But it might be useful for pretty much anybody who's working in general practice. And if you're somewhere that doesn't sort of do a lot around Medicare item numbers, or you're being asked to be a bit more involved in doing more kinds of things to bring in business, so to speak, then this video will probably be okay for you too. So enjoy. And as always, if you like the content that I produce, please check out some of my other videos, subscribe to the channel so that you don't miss out on notifications when new videos do come up. All right, so let's talk about these Medicare item numbers and why it's important to be familiar with them. Okay, so next, let's look at what we're going to do. So we are going to talk about some of the benefits of being familiar with the Medicare item numbers, how we can find them or stay updated on them and get information about them, and then how we can use them to optimize what we do in our practice and to build a bit more of, I guess, business capacity by using the Medicare item numbers. So that's what we're going to cover in this video. So in terms of benefits, one of the biggest things, I think it's really important that we understand what the Medicare item numbers are because of compliance. We want to match the descriptor to the service being provided. So every item number has got an associated description about what that service includes in order for the medical provider to claim the benefits for that service and to charge that fee. So we want to make sure that what we're doing is matching that descriptor. This is also going to give us that protection against any Medicare audits that may occur. And it just helps to guide what we're doing for our patients to make sure that we're matching the right service to them. We can also look at it in terms of patient eligibility. So are they meeting certain criteria that we can be offering certain services to them, that we're selecting the most appropriate service? And we're going to talk a bit more about this later on at the end of the video. I've got a few case scenarios. So we want to make sure that we're doing all the right things in order to claim it appropriately, that we're also meeting the requirements, because there are certain things that, say for a health assessment, for example, that we're being guided by the descriptor to include all of the things in it. So that helps us and it helps the patient as well. So this will help to optimize our patient care and also those outcomes for them by matching the right service for the right person. We're making sure that it's clinically relevant. When we have the introduction of the RACGP 6th edition, which should be coming out sometime this year, there is a bit more of a shift in focus towards those patient measured outcomes and patient reported, the PROMs and PREMs experience measures. That's it. So, we want to be making sure that we have some way of gauging the outcomes for our patients. And so these descriptors can help us do that. Productivity. So we are a slave to earning the money in the general practice. Okay, fair enough. General practice is a private business. Okay, healthy profit does keep the doors open, and therefore we can continue to give that service to our community. So it's a bit of a double-edged sword. Yes, we want it to be about our patients and providing good patient care, which is all of this that I've just been talking about, and how we can make sure that we're doing that. But at the end of the day, some of these things do bring in money for the practice. So if we're optimizing our patient billings, that we're doing the most appropriate billing for the service that we're providing, that we are looking at ways to do different services or add on different things so that we can continue to, add more billings and things like that, then that's obviously going to keep us busy and keep us gainfully employed, and also continues to bring dollars into the practice, which then feeds into all of this. So it is a little bit of a cycle, a circle of life. It's a necessary part of what we do, and there's no two ways about that. Yes, it's a bit hard to reconcile sometimes when it's often been put onto nurses that they are the ones that have to bring in the money and to keep, what can you do to be bringing us in more money? I disagree that that's the nurse's job, but we certainly can play a role. It's not their entire job. It's not completely up to them to do that. That's why there's practice managers. That's why there's principal doctors, all of that kind of stuff. It's a team effort. But you being familiar with them and how you can optimize what you're doing, yes, this is what we're talking about. Okay. And obviously we want to make sure that we've got the correct billing. We want to use the right item number for the service being provided. So that's also really important. And making sure that all the services being provided are being billed. So I see this a lot, that sometimes little things won't get added on, like a pregnancy test. There is an item number for that. If you've done a urine pregnancy test, I'm talking about. And we often do these things before we do other procedures. So before we do an IUD insertion or something, can you just get them to just do a quick urine preg test beforehand? And we forget to add that billing on. So all these, that might only be $10 or $12. It doesn't matter. All these little things, if you sat and went through how many you missed in a year, you might have missed 50. So there's a few $100s that could have come to the practice, and every little bit helps. But that was just one example there. So yeah, there's some of the benefits to why we want to be, I guess, knowledgeable of item numbers. So how do we start to find out about them, and where can we look them up? Well, our go-to is going to be MBS Online. So you go there, and it brings you up to this page. You can pop up here in the search area what your item numbers are, and then it will go through and give you the full descriptor on things. Now, another really cool little service, which you can see here with my little red arrow, is something called Ask MBS, and that's an email advice service. You simply email them a question. If you've got a query about an item number or how it's billed or when it can be used, you can send that through to them and you'll get an answer back, usually within 1 to 2 weeks. They're very thorough in their answers, and they will link it in also with where to find that information, so that it's not just them giving you a verbal answer or written answer, but it's telling you where to find this information. Sometimes the Medicare item numbers can be a little grey and open to interpretation with some things. So if you want clarification, then go for it. I've used them several times to get clarification on things, and I've always found them really useful. So that's something to keep in mind. There's also the advisory pages. Again, these are really useful because they have FAQs, and they will go through the answers to those frequently asked questions that they might get. And they'll do these every now and then. I can't remember how many they've done now, but yeah, you can go to that page, and basically you can see there's all these different ones for different services. These particular two, number 1 and 2 here, are for the general practice services. And so to those particular ones, and then they will go through a whole bunch of different information. You can see this one here. It talks about bulk billing and how to add different charges on mental health plans and things like that. I think one of the other ones, yes, talks a little bit about co-claiming, telehealth things. So it does tell you what's in those FAQs, and it does go through and give you some really good explanations on things. So have them, or have that link bookmarked on your page, and you can refer to those kinds of things if you need to get some more clarification on item numbers. Another really quick, easy one is the AusDoc quick guides. You do need to be a member with AusDoc, but it's free and it's got lots of resources there, and they have newsletters all of the time. There's a nurse one as well as a GP one, but you can then have access to these quick guides. So they are downloadable. They're always current and up to date. There's literally one at the beginning of every month. And any changes to item numbers, any additions and subtractions or whatnot are always added onto them. So they are a really good guide. There's a couple of pages worth of front and a back. Laminate them or pin them up on the notice board in the doctor's rooms or something like that, so that they've always got a handy go-to list for things as well. But you can see here we've got information about your eligibility for health checks and things. So they are a really useful guide to look at item numbers that should or can be claimed for things. All right, another couple of places that we can look at for item numbers, especially if we want to cross-check something, if we want to check a patient's eligibility. Yes, we can log on to Proda, which I think we're all pretty familiar with doing that. It's a little bit cumbersome. It's a bit, got to do this step and this step and this step, and you've got to search the item number. And it pretty much just tells you if it's claimable. It won't tell you when it was used or when it might be due. It will just tell you in this moment if it's claimable right now. So it has got its limitations. Another good one is to access My Health Record in the patient's file. So if you go into My Health Record tab, you can look at this Medicare overview of the past 12 months. If you click on that, you'll be able to scroll down and see all of the services that were claimed through Medicare. Sometimes it goes back longer than 12 months. You can see it back 2 years or something like that. And you can actually see if a care plan was billed somewhere at some point in time and when that was, if they had a bone density done or something like that, anything at all claimable. Blood tests were done, investigations were done, all those kinds of things, specialist attendances, everything on Medicare will be able to see through those. Okay, so that's a really good one to get more of a pinpoint of when something was done, so that if you're working forward now, when will it be due, then you can flag that accordingly. So that's a really good one if the patient has allowed access to My Health Record. And obviously making sure that you have access to My Health Record, because I've come across some nurses who do not have that, and so they need to go and get their practice manager to go and make sure that they've got it, it's accessible through their software for that person. Okay, so that's another one there. I will talk a bit more about some other little things in a minute, but we'll probably include this in, I think I've included it in this optimizing part, because this is the other little things I'm about to talk about. They're more about how you can look at patient eligibility rather than the description of the item numbers and where to find the item numbers. This is more about the eligibility and all of these things here that you can see. So there is a crossover between making sure that we're doing making sure that we're doing the right care for the patient to optimize their outcomes and improve upon their health and well-being and such, and stay on top of their chronic diseases and preventative health care and all of those things. There's a crossover there with obviously bringing in money for the practice and making sure that you're keeping busy as well. So, like I said earlier on in the video, we like to just not focus too much on the money side of things, but we do need to keep it in our mind, because it is a very valid and a very important aspect of general practice. That's just the nature of the beast. So a couple of examples here of how we kind of make sure that we're optimizing our patient care. So say we've got here 76-year-old is booked in for a heart health check. The GP's had a consult with them and then they've sent them over to you, or they've called you up or told the patient to book in for this, go and have a heart health check. Now, we know we can go and check the descriptor and we can see that it's going to be worth $84.09. Now, all of these are flat, like this is not taking into account any bulk billing allowances that go on top of that. It's not taking into account percentages based on regions like rural and remote or anything like that. This is just the flat amount. So $84.90. And then, of course, if we're doing a heart health check, we should be doing an ECG as well. So let's add that item number in there as well. And we come up with about $113 in value that would be given if we just were simply going to do a heart health check. Now, this person is over 75. Firstly, there is already going to be a certain degree of cardiovascular disease because of their age. So it's probably not going to be a very accurate assessment if we take into account that they've already got probably a couple of risks there already. So it's not only more appropriate to do a time-based health assessment, it's probably more valuable to the patient because we can then do more of a holistic health assessment if we're going to take at least 45 minutes between doctor and nurse, could be even more. But I just, for this example, used the 45 minutes fee, which will be $220. And of course, if you want to add in an ECG there as well, which you should, then great. So we're going to have a more thorough risk assessment and look at more of a holistic picture of this patient rather than just looking out for cardiovascular risk. Okay, so that's one example. Next, we have a 35-year-old male who identifies as Aboriginal, who they have also been recommended for a heart health check. Now, I'm going to say these are things that have actually been sent to me. Okay, these are real. These are real times where I have suggested that we do something else other than the heart health check. So, because sometimes the GPs just go, let's just do this because they're talking about heart risk, but let's look at other things as well. So as we've identified before, doing a heart health check would be $699. That would be $84.90. Obviously, with the ECG, we're going back to that $113 again. However, if we do the 715 health check, we can look at a whole bunch of other risks as well for this young man, and it's going to be entirely more appropriate. We're going to be spending probably around about the same time, 30 to 45 minutes minimum. Then we're going to, quadruple or triple that money, that income for the practice, but also we're actually going to be providing much, much better healthcare to this person rather than just focusing on one thing, their heart health. Okay, so we want to look at lots of other different things that this man might be at risk of, certainly with Aboriginality. Type 2 diabetes comes to mind, but we want to look at other things. And are they going to be, having a talk to them about other health elements? Next case scenario, we have a 47-year-old woman who has come in to have a perimenopause health assessment. Now, we can actually do another time-based health assessment for someone in this age group. So if you refer back to the MBS item number descriptor, which is 695 for the perimenopause health assessment, then we can also see, so you can go ahead and do that and bill that, but then whilst you're having a conversation about that, it might be then worthwhile getting them to come back again another time to do further assessments, because they are also eligible to do a 45 to 49-year-old health check, which is a bit more, again, holistic, middle age, stage of life health check. Not going to just be focusing on symptom management and things around their menopause or perimenopause, depending on if you do an OSD risk assessment during that health check, then they have got higher score than 12, then they might also be able to come in and you can focus a bit more on that diabetes risk too, and check their status in terms of Aboriginal or Torres Strait Islander, and if they're identifying with that, then they might also be eligible for the 715. So this was just an example of they're here for one thing, but having a look to see whether or not they are also eligible for something else. And we do that by checking that person and what's going on for them, but then comparing that with item numbers and eligibility as far as descriptors are concerned, and the rules around what we can and can't do in terms of furthering the healthcare that we provide. Um, Doing home medication reviews often gets missed a bit too. So if you're doing health checks, if you're doing your chronic disease management, you've got someone who's on polypharmacy, or they're having a few struggles around making sure that they're taking their medications on time, things like that, might be flagged during those conversations that you're having, then putting the recommendation in for having the home medication review. Depending on your practice where you work, you might be able to initiate that and then the doctor finalizes it, or you can bring it up and hand it over to the doctor if you're doing the health check and you're doing a chronic disease management plan, and you're seeing the patient first and then they see the doctor next. That can be part of your handover, saying, well, we've talked about this, we've talked about that, I flagged this problem or this issue. I suggested that they talk to you about XYZ. So, you can pop that into your handover, your recommendations to discuss with the doctor. Home medication reviews are a really important part of caring with the patient, making sure that their medications are safe for them, that they're taking them appropriately, all of that kind of stuff. So nurses absolutely can initiate this. Obviously, the doctor needs to sign off on it, but you can complete the paperwork as much as you can, and then and then hand it to the doctor to sign off on. So yeah, absolutely can be involved, and then you can follow up afterwards. So then, generally, what I will do is I'll put an action in about 3 months' time for me to follow up, and I'll just make sure that the home medication review has actually been done. And if it has the patient been brought back in to have that reviewed with the doctor so that then they can submit the billings? So, have a little system in place to follow up on things, because, again, this is keeping you busy. It's making sure that things get done that you want to get done in terms of that patient's healthcare, and it's also generating the continued income for the practice. Veterans might also be eligible for time-based health checks, which are not associated with the CVC program. So not every practice is signed on and onboarded with CVC stuff, but there are still time-based health assessments that can be done for return service men and women. So if you go to the DVA, it talks about, there's a link there. If you go to that website, or you can just Google DVA health checks, there's some information there about who's eligible for them and how they are eligible. And then again, they're just the time-based ones, so your 705, 707, that kind of stuff. Some of them might just be a one-off, which is fine. And then others may be able to get done yearly, but really worthwhile checking out. There it is there. So you can go to those item numbers, one-off health assessments. Okay, yeah, there you go. Yeah, you don't have to use the DVI item numbers either. You can just use the normal 705, 707s and stuff like that. So yeah, that's fine. All right. Also, I think I briefly said this before about just sort of keeping an eye out for any additional little item numbers that can and should be added onto the services being provided and and billed that day. Obviously, we know about our nurse item numbers, so making sure that if someone has had a 715 health check, or if they have had a chronic disease management plan, that you are somehow tracking their item number usage. I usually just we use best practice where I work, so I just keep a little note up in the what's it called? Where the social things and stuff are up the top next to the demographics. Yeah, sorry, I'm having a brain fart up there somewhere, but you can just tag it however you want to tag it. And that just tells me how many times they've been claimed this year, or how many they've got left for the year. And making sure that you're writing things into their plan, that your nursing tasks can be covered. So when they do attend for those things, that you are able to claim for them. Urine pregnancy test, as I said, there is an item number for that. So if you're doing a dipstick before they're having a procedure done or anything like that, then absolutely make sure that you're adding it on to their billing. All the additional in-house things that we might be doing, like ECGs, spiros, ABIs, make sure that you're using the correct item numbers. We get these conversations happen a fair bit in the chat rooms and in mentoring sessions and stuff, that the wrong item number is being used. So make sure you double check your item numbers, because they do change from time to time. But you want to make sure that you're using the absolute correct one for what you're doing in your practice. Okay. These Spiro ones, one of them, for example, is a one-off. I think it might be the 505 is just a one-off diagnostic one that you might do for someone. But the 506, you can do that anytime. You can do it 5 times a year if you thought it was necessary and claim it. But there's no restriction on how many times it's been claimed. So if you had someone who is suspected asthma, then you would obviously do the 11505 first, because this is the diagnostic one. And then if you want to bring them back in for a review in 3 months' time after they've been using medications, blah, 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 and recheck it, then that would be the 506. And you could do that a couple of times a year. So this is an example of making sure that you're using the right numbers for the right things. And yeah, ABIs is another classic one, because there's a couple of numbers there if it's just arms only or if it's arms and legs, obviously. So we're making sure that you're using the right one, or there's just legs only as well, I think. So just making sure. But if you're using the full ABI arms and legs, then it's the 11610. And incidentally, with the if your practice does the implanon and the IUDs, if you're bulk billing for that service, then you can add that item number onto it as well to increase the loading fee and the rebate. So that's where the that MBS the AusDoc quick guide one is really good, because it does include a lot of these little bits and pieces of information that you may or may not be aware of. So, well, probably not aware of them if you haven't heard that before, but it's really good to make sure you're kind of staying on top of the things that you can claim for, and also being aware of those opportunistic things that we can book on into the future. So can we get them back for other things when we're seeing them here and now? And then there's item numbers that we can claim, whether that's just nursing interventional stuff or nursing tasks, booking them in for, health checks or care plans, things like that, based on, conversations that you've had with them. Is there any preventative screening that they can be involved in? So coming in for their cervical screens, hey, while you're here, I've noticed that you're due for this. Or patient education things, if they're just starting, say you've just done the Spiro and they're about to start taking preventative medications, you can bring them back in for some education on using their spaces correctly and things like that. So having a look at those opportunistic things to book down the line, utilizing those item numbers, checking what they're eligible for, what can be claimed, and how you can go ahead and do that. So how do we look to see if people are eligible for certain item numbers or for certain tasks, or that they're eligible for certain services? Sorry. Okay, so a couple of different things. Data extraction tools are extremely helpful, and they are absolutely worth the investment to your practice to get hold of something. Now, there's lots of different ones around. PenCat or PenCS, Polar, then there's Cubico, things like MyGPM tool. Now, I'm not paid to say about any of these in particular. I'm just literally telling you these as an awareness, so that these are the kinds of things that are out there. I'll leave it up to you to go and look into things and see what's best for your practice. But yeah, I'm not endorsing any one or the other. I'm just simply saying that these are out there. They're really good, just not for identifying patients for specific services, but they're also great for your quality improvement activities as well. I love them. And as I said previously, when we have this new 6th edition for our ACGP guidelines, there's going to be a very heavy focus on your patient-reported outcome measures and patient-reported experience measures. So these tools will be absolutely worth their weight in gold for making sure that you're meeting those things. There is going to be a very heavy focus on that, just FYI. So what are some of these things? Let's have a quick look. I personally I use PenCat. Now, just check with your PHN as well, because I know that PenCat links in with PHNs because they do a data extract, like a de-identified data extract every month, and it gets sent away for the health department usage. And so I don't know if there's some kind of arrangement in place for, but check with your PHN and just see whether or not you can get this on your system for free or for some reduced fees or something like that. Because it is amazing and I love it to death. I use it all the time. Not just for screening to see if I can be recalling a particular batch of people, but I do use it all the time for quality improvement activities. Love, love, love it. And it's very, very easy to use. And there is actually a separate site that you can go to for the recipes. So as a little bit of a example, there's a small list there, but how you can go through and identify and target specific cohorts of patients to then recall them in because they're eligible for something. And that can be a quality improvement activity, that can be a business building opportunity for you to bring patients in so that you can, be doing some more of these high value. Sorry, I hate having to talk about it like that because, anyway, but it is what it is. To bring some more money into the practice and stuff. So that's that's why I love it. And they're super, super easy to use. These recipes, if you were to click on one of them, it literally shows you step by step with pictures, just like I'm using here, of how to do it on your screen. So you can go, right, I've got to click this button. Okay, now I do this and now I push this. Okay, done, step by step. You can't, if I can do it and I am technologically challenged, if I can do it, anybody can do it. They're so, so simple. And that's why I love it, because it's a very easy interface. So it's got to be easy for me. So that's PenCS or PenCat, as we tend to call it. Then Polar is a very similar equivalent program that you can use. I've personally never used Polar, but I believe that it's very similar. So again, you can look into check with your PHN. I think that some will use Polar and some will use PenCS. So just check and see who uses what in your particular region, in your health service. So that's another one. Cubico has been pretty popular over the last 10 years. It's something that integrates in with your practice software. It's really good for giving you reports. It can also tell you who's eligible for certain things. And that can be done in real time as well. So it'll pop up on the screen that this patient is also overdue for XYZ. This person would be a good candidate to have a health check. So little things like that. It's really good for producing reports. So from a business perspective as well as for a patient care perspective. So it's a pretty big tool. It's pretty good for streamlining things, getting data and generating stuff from a management point of view as well. But yeah, it's a really good program. It's a lot of and it does integrate pretty well with your software. So there's that one. My GPM tool is pretty much specific to your health assessments and your care planning, and also a bit of patient engagement. So they have heaps of really good patient information things and just little tools that you could just click on, and it just sort of goes through a whole bunch of stuff, and then it integrates and imports it into their file and things like that. So it's pretty nifty. It's pretty groovy. I've not used it but I've seen it in use. And so, yeah, so again, building your business capacity, but also improving your patient outcomes. And this kind of tool will be really, really useful for those proms and prems that we're going to be having to do soon. So you can use that as your quality improvement stuff, but it also will just track those things and show those patient outcomes a bit better. Everything's then just like built into the system. So these things are, you got to buy them, you've got to purchase the package, or you've got to subscribe to them in some way, shape, or form. So, this is something that you need to look into for your practice. You can contact them and have free demonstrations, the same with Cubico and things like that. And, guide you through and have an idea of what you would be investing in. But they are worthwhile because if you utilize them correctly, they absolutely will pay off in the end. All right. So hopefully that's kind of given you a bit of an overview on your nurse item numbers, how to look for them and utilize them a bit more efficiently and effectively, that we're bringing all of those things together, our patient outcomes, keeping you busy and gainfully employed, and the practice doors are staying open as well, because we're ensuring that we have this whole big circle of care happening for everybody. So thank you once again for listening, and hope you found the information helpful. Pop some any questions if you have them down in the comments below. If anybody else would find this beneficial, then please share with them. And yeah, if you haven't already, then go ahead and subscribe, because it certainly helps me build the channel a little bit more. And I'm always open to ideas on different topics that you might like me to talk about. Okay, so thanks again, and I'll catch you next time. Bye.